Now, Public Health England are launching a campaign called Be Clear on Cancer to raise awareness about the symptoms of kidney and bladder cancer. The awareness campaign has been running from February until the end of March. Now, let's take a quick look at a very short clip.
Approximately 17,500 people will develop kidney or bladder cancer per year in the UK.
People from the black community we don't talk about cancer. We see cancer as a death sentence, really.
Cancer in Asian community, I think is seen as a big taboo. So the minute you mention cancer, people think, oh, wow, you know.
Patients are often very embarrassed to come forward. They don't want to tell their friends or relatives or discuss it.
You got to get it diagnosed early on and get it treated. If you ever notice any blood in your urine, go to your GP straight away.
Joining us now to discuss what the symptoms to look out for is Jonathan Makanjuola Specialist Registrar in Urology at Guy's and St Thomas NHS Trust. Thank you for joining us today.
Thank you.
Now, can you tell us exactly what are the symptoms to look out for?
So the main symptoms to look out for concerning kidney and bladder cancer is blood in the urine. That's by far the most important symptom people have to be worried about. If you do see blood in your urine, it's very important that you go and see your GP. It may be nothing, you know, blood in the urine can be a cause of bladder infections or kidney stones, but we're really stressing that if you see it, you must get checked out by your GP to make sure it's not nothing more serious like bladder or kidney cancer.
And why is it important to see your doctor straight away if those symptoms appear?
Because bladder and kidney cancer are very treatable if caught early. If left to the late stage, then the treatment options are very limited. That's the problem.
And what are so blood in urine is one of the symptoms to look out for. What are some of the other symptoms that are maybe not so obvious to look out for?
If you have pain in the side, in the kidney area, we call it flank pain. Or in older women, very important that if they have recurrent bladder infections, they must see their GP, because sometimes it's missed as just a bladder infection and given antibiotics, but actually they may be harbouring the signs of early bladder cancer.
And there's a new film being played on VoxAfrica. Could you tell us a bit more about this film?
Yeah, this film features some African and Nigerian urology consultants and some patients we've treated at Guy's and St Thomas's who were initially diagnosed with having kidney and bladder cancer. And it just really highlights the need for patients, especially black and ethnic minorities, to seek GP treatment as soon as possible, basically try and get a cure if we can.
And if viewers want to find out more about the symptoms or where they can get treated, where do they go?
So there's really good internet resources from the NHS, but the main one we advise people to go to is www.nhs.uk/bloodinp. And that you can get a lot of information and documentation regarding symptoms to look out for and who to seek.
Yeah, I think that the details of the website are there on screen. So the message basically trying to get out is just go see your GP as soon as possible if there are any symptoms like the blood in the urine or any other niggling pains that people might have.
Correct, yes.
Thank you very much, Jonathan.
Thank you very much.